So, so now that the law is out, I won't talk about it. I just, like I said, I'm going to put a warning every time that I do something and stuff. But really important to understand those two differences between the ethics and the law, because a lot of the situation, even if the law tells you something, your ethics may be telling you something else, and you will be usually doing more stuff towards your ethics than the law. Again, in that things about that father, you would probably in a normal situation would never steal. But in the situation that he's put now, that he has no money and everything, his family, his stuff, his ethics, and his so that's where I was saying ethics and his belief and everything. Feeding his family is more important than the society's laws, and so that's where ethics kind of cuts in and stuff. So why do I talk about ethics? We'll actually do a video because there's one that there's some stuff that I want to read and everything before I do one. But so again, for example, you'll be taking as a medical person, you'll be taking very hard decisions, and we'll be talking about it right now on the base of the system that I'm proposing, or think that it's going to be more. And one thing that by looking and reading into this collapse self-reliance, and we'll call it self-reliance from now on, medicine, is that they always give you what to do, but they don't really tell you that sometime it won't work. You cannot save everyone. And this is the one thing I truly believe, and that you have to come in peace with, or kind of confront yourself or sit down. If you truly are going to be prepared medically to help people, is that there is limitation of what you can do. And I got an article. That's one of the articles I'm reading about the ethics and stuff like this. And it's on, because we'll talk about what I'm going to create, what I'm going to use for the self-reliance medicine to build this self-reliance medicine. And one of the component will be disaster medicine. And in 80, when everything collapsed, I mean, you cannot have more than collapse in there, and even it's true collapse. I mean, building collapsed, the whole country collapsed because there was nothing, like everything to rumbles, pretty much. And so, as the international aids was gaining there and stuff, they were getting into ethical decision as well. Now we have people that needs, for example, dialysis, which means that basically your kidneys are not functioning, and the machine basically works as your kidneys. So it's a filter that takes your bloods in, filtered it, and re-entered it, but clean. So when you pee, you're doing what a dialysis machine does. But when people don't have any kidneys, a machine has to do what you do by peeing. And they were saying now, well, we didn't bring those machines because it's never been part of the disaster thinking. You know, a disaster, it's a hurricane, you go there for a few days, blah blah blah, you bring. But now there was a whole country that was just like kaput. No, like no more country, no hospital, nothing. And so then they were like, okay, what do we do with that? And we didn't think. And so it became an ethics of like, can we save those peoples? And we'll be talking about triaging peoples later on, and that will be part of our process of thinking. And so that's why I'm starting to bring this concept of ethics, because it will be important about what we do, because you're not able in a limited resource situation to save everyone. It's impossible. You cannot do that. And if you go in with the mindset that you will, it's set up for a failure. Because, and this is why I'm talking about that right now, it's because mass casualty incident, so what we call MCI, mass casualty incident, is means that there's more victims than there's resource available. And this, for example, you have a bus crash and you have two ambulances coming, so there's like 4 providers for 40 people. So you have an MCI, or there's an hospital, and you have to bring those 40 people somewhere else. Those situations already there. For example, if somebody's not breathing, doesn't have heart attacks, and we'll be talking about again the triage and stuff, we'll be leaving them like this, like literally, this person is dead. It's what we call a black, and we'll talk those things again. But we leave them. Yet, if I would have the resource, so that means if I had all the stuff, it would be like just a normal day in the city, and somebody has a heart attack. Those people will get most of our attention. We'll stop everything in the hospital to try to save those people. So, depending on the situation, it does change our mindset. And this is where, for example, ethically, it is better, and that's where the concept comes, is that it is better to save many more than one person. And it's a hard concept to, it's like, it's harsh concept, not a hard, but harsh concept to go. It's like we're leaving people to die. But if we're putting all our resources to that one person, we may not be able to save 4 people. So what would you rather save, 4 people or 1 people? And so this is where the concept of ethics comes, because it's like you have to get your head around that concept as well. And we'll talk a little bit more about it, because there's a lot more into the concept of the ethics and into this. But that's why I'm starting to talk about it, because I think this is one hard thing that people will have a hard time, because it's a harsh decision. It's truly a harsh decision to say, you're dead, you're not, you may die, you're not, I'll try to save you, and you're trying to you decide who lives, who dies, well, literally, almost. So, and you're like, wow, how can you do that? But you have to, because if you don't, if you try to save everyone, you will save no one. So again, if you try to save everyone, you will save no one. So for example, in a limited resource situation, let's say you have band-aids, dressings, and everything, you're limited because, like, you cannot supply yourself for whatever reason, you've been cut up. So hospital doesn't work anymore or something like this. So you're in a self-reliant situation. Well, now let's say you have like 3 vials of painkillers. Are you going to give that to a person, or all your dressings to a person, for example, that has a burn, that may die, that has like maybe 20% chance of survival, meaning, because when we say 20% chance, it's like, that sounds pretty good. But that means that 8 chance out of 10, you will die. There's 80% chance that you will die. Versus there's only 2% chance, 2 out of 10 chance that you will survive. Versus if I keep those vials for pain control, those dressings and everything, I could help 4, 5, 6 other people that could continue, that could help. And those people, for example, if I can help someone, for example, that has a broken leg, heal. Now, especially, for example, if you're surviving in a community setup, well, maybe those people maybe that was your blacksmith or whatever, or he was having a function. So now you have someone that can do other stuff because you helped him heal his leg. So not only are you helping this person, but this person now can help other people. So this is the concept of that triage. And again, we'll come back about it. But I wanted to start putting the idea in your head, because this is the kind of stuff we'll be talking about to face those. Because a lot of stuff, that's why I found, when we face the books, they're like, oh yeah, just give antibiotics, that'll be good. Okay, but who do I give it to? Because it is a question to ask, and it should be asked, because there is a limitation about what I do. It's like, if I'm giving medication to someone, and again, in a normal situation where things would be totally normal, that means you have access to hospital and stuff, we don't have to ask ourselves those questions, because the supplies keeps coming. So I want to continue to give medication to this person. Like, for example, if we have a burn or the cardiac arrest again, we'll put all the resource that we have, because we have the resource. But if in a place where we be limited in resource, then we have to start asking ourselves, who do we give it to? And it's just like having money. For example, if you have $20, if you know that you have an unlimited supply of $20, then sure, like you can spend that $20 no matter what you want, because you know there's another 20 coming, another 20 coming, another 20 coming. But if you know that you have 20 and not only 20, you're going to start asking yourself questions. Should I buy this or should I buy that? And unfortunately, you have to become a little bit almost rational like this when it comes to resource to help other people. And it's not because how can you do that and things, it's because of if I put my resource again, and that's why I'm spending time on this one, because all the stuff that I'm going to be explaining is based on that. So it's really the base of what I'm talking about, is that if I'm spending all my resource on one person, I may not be able to help 4 or 5 other people. And if I do that, I am jinxing other people, because those people could help other people and everything like this. So it becomes a number versus the person that I'm trying to save. And the reason I'm bringing that as well, and I think you're starting to see it, is that means that the person that you're maybe not helping, maybe someone that you're very emotionally attached to, especially in a survival situation. So if you have your whole family and everything, well, it's a question of deciding, do I give the medication to my brother or something like this, or do I keep my resource so that I can help the rest of my family, my wife, my children, and everything like this, because we're limited in the resource that we have. It's a hard decision. Like just even me, like to try and imagine in that situation is like, wow. But we have to start thinking about this, because anything that we're going to build, if we don't put this in, we're setting up ourselves for failure. The reason why is that we will be doing resource to people that won't have a chance or to survive, and that's what we're going to be talking to, and we'll be trying to give us tools that we can build that. So that's why we'll be talking about like disaster medicine and everything, because there is tools out there. So how do we triage people? And that's mainly what we're going to be doing right at the starts of anything that we're doing and things like that. And that's why I'm spending so much time on this, because it is at the core of everything we're going to talk. And that's one thing I find it's missing a lot on the discussion about that self-reliance medicine, is that they don't talk about that concept enough. And it is there. And it's not just that you're going to be limited in I'll suture someone and everything will be good. No. I think so far in everything I read, I never heard anybody talk about amputation. Amputation will be something that maybe, like, I mean, if you look at in the past, during the Civil War, they didn't have any antibiotics and things like that, and so if you had a wound to the leg, that was it pretty much. Like, we'll cut it. Because if we didn't cut the leg, then the infection will be everywhere and you would become septic. Well, the medicine that we're going to be talking about here will be starting to look way more like at the beginning of the century than what we're having right now. Because no matter what reserve of stuff you have and things like that, you'll be limited. You won't be able to do the stuff that we can do in the hospitals and things like that we can have, or maintain some people things. So even like disease, like for example with diabetes and everything, that are easily managed now with still issues, but managed pretty well with the medication and things like that, and people live longer and longer and longer, they'll become a harder decision to make about things like that, because without the insulin, and especially if they're insulin dependent, they'll be pretty difficult. And so that would be another topic that we'll talk about and stuff. So that's why I spent a lot of time on this one, on the ethics part of it, because it is part of the core of everything I explained. And this is and that's why I strongly believe in it, and I spend. And sorry if it was dry and everything, but it's quite interesting. It's quite important that we have those discussions. So see you for the next one.